Welcome. Today, we'll cover key points every certified nurse aide should know about medications in geriatric care. These educational resources are supported by a HRSA grant to UND Dakota Geriatrics, a geriatric workforce enhancement program. Here are the objectives that will guide our session and support your role in safe, effective care for older adults. By the end of this session, you will be able to identify the purpose of common medications used in geriatric care, recognize common side effects and risk factors, observe, document, and report adverse reactions or changes in condition appropriately. Many older adults take medications for chronic conditions like hypertension, diabetes, and arthritis. It's important to know what these medications do and why they're prescribed. This is a list of common medication classes in geriatric care. Please note that this is not a complete list, but has some examples to gain awareness of the classes and typical medications. Anticoagulants keep blood from clotting too easily. Examples of these are warfarin and apixaban. Antidepressants help with anxiety and depression. Examples are sertraline, citalopram, and fluoxetine. Antihypertensives are used for blood pressure control. Examples include lisinopril and amlodipine. Diuretics help the body get rid of excess water and salt through urination. Furosemide is often prescribed. Pain medications help with arthritis and other aches and pains. Examples include acetaminophen, ibuprofen, and opioids, which should always be used with caution. Older adults often have multiple chronic conditions, and these are some of the most commonly prescribed medications. As a CNA, understanding their purpose helps you monitor the effects more accurately. Common medication side effects include nausea, constipation, diarrhea, and drowsiness. It is important to also recognize more serious adverse reactions, such as confusion, mood changes, dizziness, sweating, trouble with urination, or falls. Staff must be able to describe anything abnormal to nurses. Older adults are at higher risk of adverse effects from medications. They process medications differently due to slower metabolism and kidney function. Changes in body fat and muscle also occur with aging. People over 65 years of age often take multiple medications, which can interact. This is also known as polypharmacy. As a result, even standard doses can cause stronger and adverse effects. You should look for concerning symptoms or behaviors, such as sudden confusion or agitation, rash, swelling, or trouble breathing, new or worsening pain, unusual bleeding or bruising, nausea, vomiting, or diarrhea beyond what's expected, dizziness or fall. Always report changes promptly to the nurse. Timely reporting can prevent serious harm. Document accurately what you observed, when, and what you did. If a resident seems more tired, confused, or has a rash, it could be medication-related. In summary, you don't need to know everything about medications, but you should understand the basics and be alert for changes in the resident's condition. Understand the purpose of common medications used in geriatric care. Be familiar with those your residents take regularly. Be alert for signs like dizziness, confusion, rash, or changes in mood or behavior. Know what's normal for each resident so you can spot what's not. Your observations are critical. You are the eyes and ears of the care team. Ask questions if something seems off. Report anything unusual promptly and clearly to nurses or supervisors. Follow your facility's protocols for documentation and communication. Stay alert. Monitor residents, especially after new or adjusted medications. Your role is vital. You help prevent serious issues by being observant, informed, and proactive. Thank you for making medication safety a priority. Your attention makes a difference.